afternoon everybody. My name is Dr. Asna Naqvi and I have come from Lucknow, and I am a part of the C2 course 105th batch at Dr. Pankaj Talwar sir's institute. So today I am going to talk about the prerequisites for IUI. So whenever we are going to start any patient, when we recruit a patient for IUI, the prerequisites are very basic. One is that at least one of the tube should be open, and the second is that the pre-wash sperm count should be at least 3 million, but practically it is said that we get better results when it's up to at least 5 million, and the post-wash sperm count is at least 1 million, but again we see that practically we get good results if the post-wash sperm count is at least 3 million. Other requisites include that the uterine cavity should be normal, and we see the ovarian reserve of the lady. Okay. Now the next thing is that we need to understand that infertility is a very sensitive branch, and we have to form a rapport with the patient. In order to do that, it's very important that we clearly make our patient understand that the success rate of IUI is around 10 to 15% per cycle. And hence it is advisable that when we embark on the journey of IUI, then we do at least 3 cycles in order to achieve a result or a positive pregnancy test. We can go up to 6 cycles as well. There are centers who do up to 9 or 12 or whatever cycles, but keeping in view the total cost that is involved in the process of IUI, which comes between 7 to 10,000, practically we stick ourselves to 3 to 6 cycles per patient, and if that doesn't work, then we think of alternative treatments for infertility. Now when we are doing IUI, what is important is that we think about some troubleshooting. Now in this cohort of patients that you have shortlisted for doing IUI, there will be patients in which you will not be able to do the process of the intrauterine insemination per se. Now this is the most important bit of the take-home message from this video would be that it is advisable. What can we do about such patients? Now imagine a scenario where you have already started the ovarian induction, you have given letrozole or clomiphene, you have given HMG, the patient has come, you have given the HCG trigger and patient has come with the sperm wash, and then you are standing there after having spent like the whole 7,000 rupees or 10,000 rupees of the IUI, and then when you are standing with the catheter, and you realize that you are not able to pass through the cervix, and hence you are not able to do the IUI. Now that would be a difficult situation, and hence it is advisable that we do something which we call as a mock IUI. So when you get the patient and you are recruiting that patient that okay, you will be a candidate for IUI, so before you actually start the process, there are 2 occasions where you can do the mock test. Either you can do that mock before even you start the cycles of IUI. So whenever the patient has come to you, you can just take an empty cannula, just pass it. During that process itself, you can document in your notes whether it was easy to pass through the cervix or not. If not, then what was the difficulty? Was the cervix stenosed? Was the uterus acutely anteverted? Was the uterus acutely retroverted, and hence you could not pass through the cervix? If at all you are dealing with the acutely anteverted uterus, then you would know that okay, whenever these patients come for IUI, I need a full bladder. If you are dealing with the uterus which is acutely retroverted, then you will have it in your notes, okay, whenever this patient will come for IUI, I need to have a partially filled bladder. Or many a times you will see patients who have a stenosed cervix. In those patients, you can either pass, you can do hysteroscopy, that would be the best thing to do, the safest thing, or you can just try the dilators or passing the sound and make sure that you have an open cervix, try to pass the cannula, and the next cycle the patient would be ready for IUI. So in that way you will avoid a difficult situation. But now talking of the situation, suppose when you have not done a mock IUI and you get the patient where everything is ready, the patient has already spent the money on the ovulation induction and trigger and everything, has already spent the money on making the sperm sample, and you are in a situation standing there and you know that it is not getting done. In that situation, the only thing that you are left is to pass the semen sample in the cervix itself. But as I said, infertility is a sensitive branch. It is very important to have a rapport with the patient. It is advisable that you honestly tell the patient that this is the situation. I feel your cervix is stenosed. We have not been able to pass through the cervix. Advise the patient for sexual intercourse in the next 3 days, and then say that after this cycle, if at all you do not get pregnant, then we will do a mock IUI, and then we will see where the problem is, and then we will try to tackle that problem before we do the next cycle of IUI. Thank you. Any questions?